An accessory that everyone wants, especially in the warmer months. I'm talking about great guns. Ladies, let's see those arms. Let's see those. Okay. All right, you've got some good ones in the audience today. But if you're waving, is there something waving back at you? Okay. And it's not the person you're waving at? Well, women like First Lady Michelle Obama, celebrities like Jennifer Aniston, Angela Bassett, and Madonna are proud of their toned and tight arms, and they should be. But you don't have to pump iron all day to get them. We have a shortcut. Here to tell us more is Dr. Jim Cain, Medical Director of Innovative Aesthetics, and his patients are Vicki Rutledge and Robin Leader, who are also with us today. Please welcome them. All right, doesn't hurt to work out, but there are times when people say, I've been to the gym, I've done everything I'm supposed to do, and I still have that big flabby thing there. So there are options.
There are options, very good options these days. And you're exactly right. As we age and our metabolism slows down, you can do biceps curls and triceps extensions 5 hours a day for a week, and you still got this little thing hanging there. So there's some great options that I want to tell you about. The first one being Vaser Lipo Selection.
And is that the one that our first guest right here had?
Yes, ma'am.
Okay. And what's involved in that? And first of all, let's take a look at her arms before and after, if we have those pictures, and so that we can, while we're taking a look at that, explain to us what it was with your arms that you didn't care for.
The flab right here.
The little extra. Okay, wow, look at, wait, let's get that before and after picture up again if we could. That's, look at that. You can see that big dip right there. And tell us what the procedure was again, doctor, and what exactly was done here.
It's called Vaser Lipo Selection, and it's actually a form of liposuction that uses a small cannula. This is the size cannula that we use. And this does go through through a small incision. The incisions are made in places that are cosmetically acceptable, like here and in the axilla for the arms. This cannula actually emits an ultrasound beam from the tip, and the frequency of the ultrasound beam is such that it literally vibrates fat cells to pieces. Once that happens, we're able to insert another type of cannula about the same size and remove those fat cells. So,
what had you done before to try and get rid of that extra situation there under your arm?
I've been exercising, doing hip-hop abs, working out my arms for several years, and it just would not go away. And every time I've been exercising for years, and my kids were always hitting my arms.
Don't we love them?
It drove me crazy. They're always grabbing my arms. Every time I'd lift my arms up, my kids were always, I worked out and I worked out.
Because the rest of your body, you're thin. You look like you work out, and that's at one spot.
And it would never go away. It didn't matter. I mean, I had, my arms were hard up here, but it just would not go away down there.
Yeah, so you thought you would do this, and you did. What was that experience like?
It was great. I was nervous, but it was great. I mean, at first we talked about Thermage, and then when I went in, he said, we're going to do lipo, and I went, no, not lipo.
Because we're thinking about the old form of lipo.
I know. I was thinking of the big tube, that I saw on the 90210.
Yeah, they're like, yeah, they have goggles on and like shoving. Yeah.
I thought, no way, not that. And then he explained to me what it was, and I thought, okay, I can do that. I went home and talked to my husband, and did a little research on it because he told me he knows how I am. I went home and did the research, and I thought, okay, I can do that. And it was great. I've loved it.
Yeah, and it looks fantastic. And you talked about going into an area that would be acceptable. I don't see a scar anywhere.
I don't have a scar at all.
Yeah.
And there's not one at all.
Okay. Our next procedure was done on Robin. And Robin, what was the situation you were dealing with your arms that was driving you nuts?
It was pretty much the same situation. I've been working out for years also. And I have fairly, muscular arms to begin with. But as I've aged, they've kind of drooped also. And so I just wanted more definition, and I didn't want anything invasive.
All right, Dr. Cain, what did we do here that was different?
in Robin's case, we did a procedure called Thermage, and I brought the cannula with us. Thermage.
And while you're talking about that, we are also looking at before and after pictures with her arms as well. All right, so Thermage, and this is?
This is the Thermage tip here, or the probe. This tip actually emits a radio frequency beam, much like the radio frequency that your car radio, picks up. The beam, when it interacts with the collagen in the skin, causes the collagen to shrink up to 70% in length. So, of course, what that does is tighten the skin. Collagen is the main structural protein in skin, as you know. And So the collagen shrinks, new collagen comes in, the skin is tighter and healthier.
How long before you notice a difference?
I would say about 4 weeks, but it works up to 6 months, and I've been really pleased with the results.
All right, and how long does something, and she said up to 6 months, so about 6 months of that last? And then
Well,
you
no,
get another treatment, or does it last for as long as you take care of yourself?
No, the results last forever.
Wow.
The results are permanent, but you will notice continued improvement
I see.
for up to 6 months, actually out to a year.
Okay, and then when it comes to the lipo treatment there, is that something that will last forever as well, as long as you kind of mind your P's and Q's?
Yes, those fat cells are gone. They don't come back. And so it's interesting, Deborah, there's some brand new research showing that fat cells actually secrete a hormone, and the hormone makes you hungry. So if you can remove fat cells, the hormone level drops, you're better able to diet.
Okay, and we showed these procedures on arms, but both of them can be used in other areas of the body as well.
Absolutely.
Your tummy, your thighs, yeah, they're like, oh, yeah. Girl, wherever you have a problem, it can be addressed. All right, Dr. Cain, thank you very much, and ladies, thank you very much. You look fabulous. For more information on these procedures and the other services they offer, you can log on to Innovative Aesthetics website at ia-houston.com, ia-houston.com. You can also call their office number. It is 713-468-8759.